everybody, welcome to my channel. My name is Patricia. I usually make videos on fashion and lifestyle, but this video is going to be a little bit different. You can already tell by the title. This is a heavy topic, so if you don't want to hear about any surgical experience and emotional struggle, please keep this video. Pregnancy loss and ectopic pregnancy journey is a very hard topic to discuss, and it took me a lot to get the courage to talk about this. I'm not a professional. I hope that this video will help somebody out there who's going through the same situation that I had gone through. So let's begin. When COVID hit in 2020, I lost my mom. I was actually battling with my emotion. Fast forward, me and my husband, we both wanted to have our own family. I just felt that I was never ready. It's because I was going through a lot. My mom's cancer and everything was a lot for me. So in August 2021, I got pregnant. It was not planned. I was still processing everything, but I thought that maybe this was meant to happen. I was happy overall. My husband was over the moon, very happy. I made doctor's appointment. When I hit 6 weeks, I started having spotting, and we went to the ER and they let me know that the baby doesn't have any heartbeat. They suggested me to see my OB. I made my OB appointment for my miscarriage instead of the 8 weeks appointment. I needed 2 rounds of medication. So everything was cleared out. In November, I saw a little bit of spotting. It was resolved by December, so that lasted up to 2 weeks. And then I started having pelvic pain, so I saw my OB. And after some tests, they told me that I have yeast infection, so they gave me medication for that. So I took it. And in January, right after that cycle, I got pregnant. I was very happy, and I thought that this is maybe the light after the dark tunnel. I made my OB appointment, but when I was around like 5-6 weekish, I started having severe abdominal pain, and I was very gassy. I was throwing up, so I thought that maybe it's just the pregnancy hormone that made me to throw up and made me gassy, but it was not normal. I don't have heartburn, I don't have gas problem, but it was very, very bad. I called my OB. They told me to have Tums and to eat in small portion if I'm having gas, but it was not helping. I was having severe pain, and my neck, shoulder, this portion was hurting so bad. So I didn't wait. I told my OB that I'm having this issue. So they told me to go to the ER. I gave myself some time to feel better because I was thinking that I was just paranoid, and my pain was getting worse day by day. I was tired, I was gassy, I was throwing up, and it was for a short period of time. Everything happened very quickly. It was like 2-3 days. When I was 6 weeks and a half, I was sleeping one day. It was Friday night, I guess, and I woke up in severe pain. I went to the living room. I sat there for a while. It was like around 3 or 4 a.m. in the morning. I was feeling so bad, and I felt that maybe I should get some sleep and I can call my doctor the next day. I was walking to my bedroom and I blacked out. I fainted. My husband took me to the bed later. I got some sleep, and again, I thought that it was from my weakness because I was not eating anything. So the next day was Saturday. Saturday whole day I had to struggle with my pain. It was very bad. By Sunday my pain got better, but I saw a little bit bruising on my belly. So I thought that I failed the other day. Maybe I hurt myself. That's why I have that bruising. From Sunday I was nauseous, but I could tolerate my pain. My OB called to check on me, so I told them that yeah, I am tired, I'm very weak, I am nauseous, but I can tolerate the pain. I still have some pain, but I can tolerate that. She asked me if I'm having any bleeding or anything. I didn't have any bleeding, so we stuck to our appointment. That's my 7 weeks mark. I had to wait 1 good week for my OB appointment. I was very tired. I was like napping every now and then. I experienced that my belly was getting bigger and bigger. I was a little bit surprised why my belly is getting bigger, because I'm not there yet, but why my belly is getting big. So finally the day came, my appointment day. I was very happy, very excited. Me and my husband, we both were very happy to hear the heartbeat, to see the baby for the very first time. My appointment was in the afternoon, around 3:40 or 4 p.m. So since it was very early, they did the sonogram, and I saw her face. Her face was telling me that she didn't expect to see what she was seeing. I asked her what happened. She said that, wait a second, I'll be right back. So she went inside, talked to a doctor, came back, and she looked up again. So I asked her what happened. Do you see the baby? Is there a heartbeat? Is the baby okay? She told me that she can only see fluid in my belly. My belly is full of fluid, she cannot see anything, and she told me that you are in good hands. The doctors will talk to me and they will help me. So I was waiting for the OB. My OB came and told me that the pregnancy is not in my uterus, it is in my tube. It was in my left tube, and my tube was ruptured. We can't save the baby, of course. My tube was ruptured, so I was bleeding and my belly was full of blood. They have to clean up all the blood and blood clots. We were not ready for that. It was very shocking, and she told me that we need to do this surgery immediately. I asked her, can you not give me any medication to pass the tissue? She told me no, they cannot do it this time. They need to do the laparoscopy to clean up the blood and to remove my tube. So I asked her if she can save my tube. She told me that no, it's fully damaged. They cannot save my tube. It's better to remove it because ectopic can reoccur. Then I remembered that I started having bruising on my belly. I showed her that. Then I saw my doctors got worried looking at my belly, and they told me that this is the blood that came to your skin, and that's why you have the bruising on your skin. They have to do this surgery as soon as possible. So they gave me 1 hour to go home. I came home, I packed my bag, I said bye to my cats, and I went to the hospital around 6 p.m. that evening. So they ran so many tests, and they drew my blood every hour to see how much blood I was losing. So I couldn't sleep the whole night. It was after COVID, so they didn't allow anyone in the patient's room. Around 6 a.m. in the morning, I fell asleep, and my doctor woke me up. She told me that you lost so much blood, we need to do the surgery as soon as possible. And she told me that she may have to make an incision to clean up the blood. And I said, okay. I asked her, am I going to die? She told me that now that you are here, we are going to help you. The only risk is the surgery. So I said, okay. She told me to get ready for the surgery. I dressed up, and I looked out the window, and it was too much to digest. It was a lot for me. I lost my mom, I lost a pregnancy, and now I was losing another one. I was losing a tube, and I felt like I don't want to wake up. I don't want to wake up from the surgery. I was also told they may have to take my uterus, ovaries, and whole bowel system out to clean up the blood and blood clots. I told my OB that can I see my husband for the last time. She said, why is the last time? I say that because I don't feel like I want to wake up. My OB is very nice, very kind. She permitted my husband to be with me in the pre-operative room, and we did all the paperwork for my surgery and all the consent forms. The nurse brought me a paperwork. She told me to write down the mother's name, father's name, and I said that why do you need my mother's and father's name? She said it's not for you, it's for the baby. I was like, okay, so I have to do this. I mean, it's tough. I don't wish this to happen to anybody because it's very tough. My husband wanted to do all the paperwork, but I say that I can do this. And my OB and my husband, they both suggested me to talk to a spiritual talker, a therapist. I said no, I don't want to talk to anybody, but they insisted and I said okay, I will. I talked to a nice guy. He helped me to feel better, and I said that yeah, I should live my life that my mother gave me, my parents gave me. I should live. I have 2 cats. I have a wonderful partner. I have to live. When I was walking to the OR, I told myself that I can do this. I can do this. So they put me to sleep, and I woke up, and she told me, and my OB told me that they're done with the surgery. You did good. I said, you're already done? She said, yeah. We did the cleanup. We removed your tube, and we didn't have to make that incision. Everything went well. So I was given 2 bags of blood. I needed blood transfusion because I lost so much blood. I went home at 6 p.m. that day. It was a 4.5-hour surgery. My tube was ruptured the day I was fainted. That's why I had the bruising and my belly got bigger. They told me that they need to check my blood every week to see if my beta HCG has gone to the normal level. In my case, HCG got back to normal in 6 weeks. So my OB told me to wait 2 months to try for a baby because I needed to heal. I asked my OB, I don't even know that if my right tube works or not. I don't know if it's functional. Can you check? She told me that you need to try 6 months, and if it doesn't happen, then we can do the test. And she also said that don't worry, you don't have 2 tubes, but you have 2 ovaries. We see in pictures that tubes are like this, but in reality, tubes are not like that. Tubes can move, and tubes can fetch egg from both of the ovaries. She told me that you have right tube, so your right tube can move to your left ovary and fetch egg from there as well. So be positive. She gave me hope, and overall my healing process was good. The bruising took some time to go away. It was like 2 months, 2.5 months. I have realized that physical pain goes away, and mental pain, you cannot ignore that too. You definitely want to take care of your mental health. There are professionals. Talk to a professional. You definitely want to talk to someone who understands you. And at a point I felt that maybe I'm not meant to be a mother. I felt so depressed. It was a very hard time. I'm not gonna lie, very hard time for both partners. So stay put. You have to be really brave. I used to read, I used to watch videos who had ectopic pregnancies. And I saw so many women who got pregnant after losing 1 tube and after ectopic pregnancy. So I had hope. So I waited 2 months, and then we felt that we should go for a vacation, maybe in Hawaii. Honestly, I was not even trying. And after a week, I felt very weak, and of course I missed my date. So I was like, maybe I'm just late, but it's coming. 5 days late by then. I took the pregnancy test and it came positive. I was shocked. I was questioning myself, is it even true? I called my OB that I took the pregnancy test and it came positive, so they told me that you have to come to the office as soon as possible. They have to draw my blood to check my beta HCG and progesterone to see if the pregnancy is in the uterus. I went to my OB's office like maybe 3 times in that week. They made sure everything was good, and around 6 weeks they did the ultrasound and they could see the sac in my uterus. So it was great. My whole OB team was so happy for me. My husband was so happy, but I was so overwhelmed that I couldn't even feel the happiness. Now when I look back, the day when they did my surgery, I thought that I didn't want to wake up. But the day when I saw the sac, I felt that this is the light. I needed that. It was June when everything happened, and my due date was 11th February. I'm gonna share my pregnancy journey in another video. It was exactly 1 year apart. I had my ectopic surgery on 28th January, and 9th February, my son was born. 28th January, this date is so important for me. I couldn't hear the heartbeat, I couldn't see the baby, but we will meet someday on the other side. So if you're someone who's going through pregnancy loss and ectopic pregnancy journey, I'm sending you a tight hug and my best wishes. You can do this. This is a very hard time, and you want to take care of your mental health and physical health. You want to be around good people who give you support. Let me know in the comments below if you have any question. I'm happy to answer. I'm gonna end this video here. See you guys next time. Take care. Bye.